Hello, and welcome to UCSF Women's Health Physical Therapy Residency Info webinar. My name is Nina Ka. I am the program coordinator for our program. The mission of the Women's Health Physical Therapy Residency program is really to prepare our residents to promote not just women's health, but pelvic health overall, and to provide excellent patient care to people with all pelvises. Our name is Women's Health, but we aim to provide a comfortable environment for all people. So we provide care for cisgender men and all trans, and non-binary people as well. UCSF is an academic institution, so we really emphasize teaching and provide opportunities within our curriculum to allow our residents to grow as educators as well. The UCSF Department of Physical Therapy and Rehabilitation Science is comprised of 4 faculty practice clinics. We have over 90 clinicians total across various specialties. And our pelvic PT specifically practice within the faculty practices and within embedded clinics that we have within the Women's Health Center and the gynecology and urogynecology practices. We also have the opportunity to partner with San Francisco State University to run our DPT program. And then we also have some clinicians that work out of our Health and Wellness Center to provide group exercise classes and physical therapy services. Program details. So we are a candidate program, but we are on track for accreditation in 2026. The program length is 12 months with a September 1st start date. We have the capacity for 2 residents, which will both be based at our UCSF Mission Bay campus and specifically at our Bayfront Medical Building, which is a brand new building that opened last year. You can see it in the image here, a picture of the outside of the building, as well as the gym space. That clinic is our specialty clinic, so you will share it with our neuro PTs, including neuro residents, speech therapists, and occupational therapists. The program itself is, like I mentioned, a 1 year long program, and each week will look a little different, but generally will include around 26 to 30 hours of direct patient care, um, 4 hours of one-on-one mentoring. We're split up into a trimester system, so you'll have 3 mentors total throughout the year, and work with each mentor for 4 months. You'll also have somewhere between 4 to 8 hours of didactic content per week, and this could include just straight lectures, journal clubs, interprofessional rounds. We might have you observing different specialty clinics like the endometriosis clinic or urology. And there are also opportunities to teach within the DPT program. This is varied based on need and how much pelvic health curriculum is in the DPT program. It's a sample weekly schedule. Again, this will look different, potentially week to week, but it is going to be a Tuesday through Saturday schedule for our residents. And didactic may occur on a different day each week. Mentoring might be on a different day each week. But typically in the first trimester, you'll have about 2 times a week of didactic courses, and that tapers down to 1 to 2 in the second trimester. And the third trimester will be primarily clinical practice. Thursdays, we have a meeting each week, and that rotates between a staff meeting, an in-service, or a resident-run journal club. Mentorship occurs once a week for a half day, and again, might not occur on Wednesdays like in the sample, but should be fairly consistent week to week. And then, like, as I mentioned, teaching is also variable based on where the curriculum is in the DPT program. Here's an overview of all the didactic modules we'll have throughout the year. Um, we are fortunate to be able to host a level one course during the first weekend of orientation. This past year, we did host Herman and Wallace level one. And so, because taking a level one course is required as part of residency, um, this is an opportunity for you to take that. If you have already taken it prior to the start of the residency program, you can either retake the course or take the credit from the course and take a different Herman and Wallace course at a different date, um, using one of your continuing education days. We do have some shared courses, which are highlighted in yellow. Some will be shared through all the residencies, including ortho and neuro residents. Some of them may only be with the women's health and ortho residents. But it's really nice aspect of our residency program is that we get to interact with the residents from different programs as well. Majority of these modules are going to be delivered in person, though there may be some remote instruction over Zoom, but any lab sessions will occur in person. Here is that really general overview of the content throughout the year. So running from September through August of the following year. So we cover a lot of different topics and we try to spread it out as much as we can so we're not overwhelming you. And we also try to um, kind of monitor which new diagnoses that you're getting and correlate that to which didactic content that you've had. So, for example, you wouldn't be seeing bowel dysfunction patients until after you've had your bowel didactic content to make sure that you have all the information that you need to start treating those patients effectively. We also have assessments 3 times a year, and that includes 3 written exams and 3 live patient exams. We'll also have different clinical competencies or kind of skills checklists that will occur throughout the year, and that will occur during mentorship, and that really is resident led. So, when you feel ready to get checked off, then that will occur. Some other unique features of our program specifically. So, as I mentioned, we are lucky to be in partnership with San Francisco State University to provide a DPT program, and so you'll have the opportunity to teach as a lab instructor in some of the courses with the DPT students. And with that, you'll get feedback on your teaching from both students and the course director. So really to help grow your skills as an educator there. And we have courses built into our curriculum specifically to help enhance your teaching skills. We also have a lot of offerings through UCSF to help improve kind of clinical education. So if this is something that you're passionate about, we really have a lot of opportunity for that. We also get opportunities to collaborate with our other residency programs. So we have an ortho, neuro, and acute care residency right now. Um, and you will get some interaction with all of the other residents. We also are a large university hospital system, so collaborating with different healthcare providers is very easy and seamless. Messaging through kind of our EHR system, being able to ask, doctors, nurse practitioners, all that different questions about clinical things is a lot easier compared to maybe not an integrated health system. So application, we do require a personal statement. your transcript, and letters of reference, two of which must be from a physical therapist who personally knows you and your abilities, and then one from a previous course instructor, who could be a who doesn't have to be a PT but could be, and then of course your CV. So applications close February 15th, and we are using RFP TCAS, which does require a fee, though we do not require any additional application fees. We will review your applications pretty soon after they're submitted in February, and we will select our applicants and invite everyone for interviews via email, probably late February, early March at the latest. And then by pretty soon after that, you'll be notified of your application status. We say April, May just to give a buffer zone, but typically we get back to you fairly quickly. Interview day is scheduled for March. The exact day is to be determined, but it will be a virtual interview. It's going to involve two parts. There's going to be kind of a discussion-based interview with kind of typical interview questions, and then a clinical case where you'll we'll ask you some questions. And you'll walk us through kind of your clinical reasoning, and things that you would do for the case specifically. If you have questions about the interview process, feel free to reach out to us at the email on the screen here, whptresidency@ucsf.edu. Speaking of questions, again, you can send any questions about the program at all or application interview to that email that I just mentioned, or you can also email our program director, Leah McIntyre, at the email you see on the screen here. All right. Well, thank you for your time, and I am looking forward to seeing all of your applications very soon.